This month we're going to talk about first aid. First aid is immediate care given for an injury or illness until additional medical care is available. First aid is not intended to replace treatment by a physician or other medical professional. And not every injury should be handled with first aid alone. When in doubt, get help and call 911 for a severe or life-threatening emergency. Everyone should know where the first aid kits are located. Every vehicle and every building should have a first aid kit available, and they should be easily accessible. We need to make sure to keep those first aid kits stocked, and each kit should be inspected at least once a month. And want to make sure that you have all your items in there, and if someone uses something, make sure to get that replaced. And Cintas comes to most of the buildings once a month and stocks the building first aid kits. Here are some pictures of the inside of those kits. The picture on the left is from a vehicle kit, and it's a fully stocked kit. There are even instructions in them to walk you through basic first aid if you're unsure about something. The picture on the right is from a building kit. There's a lot more in these building kits. They also have those instructions to walk you through if you're unsure about something. And if you're in a utility vehicle that does not have a first aid kit in it, please let me or someone know. I have some vehicle kits available for anyone that needs them. Let's go over how to treat a minor cut. Before you treat a cut, you should wash your hands. Washing your hands will remove germs that otherwise could infect the cut. And if you are not somewhere you can wash your hands, you can use the sterile gloves that should be in the first aid kit. And if you don't have any sterile gloves, you could also use hand sanitizer if that's all you have. If you are dealing with a minor cut, you should apply pressure by using a sterile cloth or gauze. You should keep that pressure constant and don't remove the cloth or gauze to look every few seconds. This will make it take longer to stop bleeding. If you can elevate the affected area, that's going to help stop the bleeding too. You can also help to stop the bleeding by raising the affected area above your heart, but that's only possible when the cut is on your arms or your legs. If the cut is on your torso, you should just apply pressure. Once you have got the bleeding to stop, you can apply antibiotic ointment. Antibiotic ointment will help the cut stay infection-free. And also, after the bleeding is stopped, you should cover the wound. You want to make sure that the bandage that you choose is going to cover the wound completely. Now let's go over how to treat minor burns. If you or someone have a minor burn, you should cool the area with clean, cool running water. Do not apply ice directly to a burn. Do not break the blisters, and seek medical attention for serious burns. If you have an injury that happens while you're at work and it's a severe or life-threatening injury that requires medical attention, this would be something that is beyond first aid treatment, then someone around you should call 911 so that you can be transported to the nearest medical facility. Emergency showers and eye wash stations are also considered a form of first aid. Emergency eye washes are required where there is the potential for workers to be exposed to corrosives, strong irritants, or toxic chemicals. And if major portions of the worker's body would be exposed to these substances, an emergency shower is also required. Here are some examples of the emergency washing stations that we have around the different plants. Picture number 1 is from the chlorine dock at Faulkner Lake. It's an emergency eye wash station, and to make it work, you will push the paddle and the water will flow out. You'll put your head down to the water and then hold your eye open, and you should flush your eyes for at least 15 minutes. There's also a shower on the Faulkner Lake chlorine dock. I just don't have a picture of it on here. It's right beside of that eye wash. They're just two separate areas. Picture number 2 is of the eye wash station in the Vacon Bay at Faulkner Lake. It works exactly like I explained for the last picture. Picture number 3 is from the White Oak chlorine dock. It has a shower and eye wash station all in one. To make the shower work, you're going to pull that triangle bar down, and that'll make the water come out of the shower. And to make it stop, you're going to push the bar back up. The eye wash station works the same as how I explained in the other pictures. Picture number 4 is one of the stations we have in the lab building at Faulkner Lake. If you've ever been in the lab building, you can't miss them. We have 2 that look just alike. They work the same way as I explained for the White Oak station. Pull the bar down to start the shower, push it back up, and then for the eye wash, you push the paddle and the water flows out. There are more of these emergency stations around at every plant. 5 Mile and Maumelle also have them. And for all these eye wash and shower stations, we need to make sure that they stay clear and they're clean, and that their areas are not cluttered up. We want to make them easy to get to. If you find someone unresponsive, you should call 911, begin CPR as soon as possible, and use an AED if available. We also have 4 AEDs located at the Faulkner Lake plant. There's one in the lab building, there's one in operations, there's one in the administration building, and there's one in the engineering, maintenance, and construction building. If you have a minor injury that happens while you're at work that needs more than first aid treatment, but it's not a life-threatening injury, you should go to Concentra Medical Clinic. It's located at 3470 Landers Road in North Little Rock. Their hours are from 8 a.m. to 5 p.m. Monday through Friday, and they are closed on weekends. Concentra is located in the same area as David's Burgers. It's just on the other side of the parking lot from David's. If you are injured at work and it occurs out of Concentra's normal business hours, or for some reason Concentra is not available, you should go to Baptist Urgent Care, and it's located at 3550 Spring Hill Drive in North Little Rock. They are open 8 to 8 Monday through Friday, and 8 to 4 on Saturdays, and 1 to 6 on Sundays. The location is down Spring Hill towards McCain, and it's on the right-hand side of the road right before you get to the light at McCain. If you have an injury that happens at work that occurs outside of all of these normal business hours for Concentra or Baptist Urgent Care, then you would go to Baptist Medical Center Spring Hill Emergency Department, and it's located at 3333 Spring Hill Drive, North Little Rock, and they are open 24 hours a day. This is a picture of the emergency room entrance at the hospital. It's located on the back side of the hospital, and there are signs that will direct you to the emergency room door. Post-accident drug and alcohol testing will be performed at the medical facility or a testing facility. Employees that are involved in an accident or employees with a major or minor injury should at no time transport themselves to a medical facility or a testing facility. Your supervisor should be informed as soon as something has happened, and they will arrange for someone to take you in, or they will come and take you themselves. All injuries requiring treatment should be reported to the Human Resource Department immediately by the supervisor. The employee and the supervisor should complete the appropriate accident reports as soon as possible. This should take no longer than 24 hours to complete, and then you need to file them with HR right after. All injuries, even those which do not require first aid treatment, are to be reported to your supervisor immediately. The supervisor should then notify the HR department and make sure all the appropriate paperwork has been filled out. If you have any questions or comments, you can stop by the lab and ask for Mary Beth, and I'll try to answer those for you. Or you can call me at extension 104.